on cerebral visual impairment. I hope we can involve you and we can have an interactive session. So please be free to ask any questions. So we have very eminent speakers here and a lot of nice work who are actually working with the children with CVI. So our first topic will be, I'll be introducing the speakers, and then we hand it over to Dr. Nipa for the etiology and the pathogenesis of CVI. Ophthalmic manifestations and how to assess I will be discussing. How to differentiate for the low vision in children from OVI and CVI, Dr. Reena Gupta. And correlation of higher visual deficits with MRI imaging will be done by Dr. Sovita Rath. And then we have Dr. Sachu Ramalingam, who will be presenting on early intervention strategies and ensuring quality of life in children with CVI. आगे नहीं जा रहा है. Okay, I'll just short CV because we don't want to waste time. Next slide, please. Yeah, okay. We have Dr. Nipa. She is from the local city and Mumbai. She has done a fellowship of pediatric ophthalmology and strabismus at Singapore and SNC, Singapore National Eye Center, and at Jules Stein Eye Institute, UCLA. A lot of knowledge, and I think we should take as much as possible from her. She's also worked with Dr. Rosenbaum, Dr. Diemer, and Dr. Eisenberg, all the names we have heard, and we want to see how much she learned from them and she can give it back to us. She has done exclusive pediatric ophthalm practice 17 years. I have known Nipa since 17 years. So she has been training fellows and has numerous publications. Dr. Sovita Rath is in the Department of Pediatric Ophthalmology with me at SCH at Shroff Charity Eye Hospital. She's been trained at LB Prasad, Hyderabad, and she's actively involved in our hospital in various teaching and training programs. Her main interest includes strabismus and neuro-ophthalmology. And she recently has won the Best Poster Award at last AIOS, which she'll be getting that award this year. And also the presentation in neuro-ophthalmology at the annual DOS. Dr. Reena Gupta is a professor at AIO PGIMS Rohtak. She is a SCH alumni, Dr. Shroff Charity Eye Hospital alumni. She had done a fellowship in 2015, and she has developed the practice in pediatric ophthalmology in a medical college, and she sees a lot of children, and a lot of efforts have been put in developing it like a total pediatric ophthalmology setup. She has won a best paper, free paper at the 33rd annual conference of North Zone Ophthalmological Society, won the Dr. Subhash Dadaya Gold Medal for Best Case Presentation at SPOCI, and Dr. Yogesh Shukla Gold Medal for the Best E-Poster Presentation at Annual SPOCI. So she'll be speaking on how to differentiate from OVI and CVI. We have Dr. Sachu Ramalingam. She's also from the local. She's from Mumbai. She was with me, I think, in 2003 at Shroff Charity Eye Hospital. In fact, she inspired me towards visual rehabilitation. In medical colleges, we were not taught about rehabilitation. We were just told, okay, you do surgery and you operate and you do clinical cases. The post-operative rehabilitation of my pediatric cataracts and everything, she put me into it, and she's been my inspiration since then towards low vision and rehab. She is currently the head of quality assurance and inclusive education of Kangaroo Kids Education Limited and Billabong High School International Schools in India and abroad. We also have one in Delhi. She is a visiting faculty for medical psychology and low vision rehabilitation at Lotus College of Optometry, and was on the board of All India Federation of the Blind. So anything you have, any policy decisions, anything you want to change in Bombay, meet her and ask her to do it, please. Today she's here and I think she meets all the principals of the schools. She gives them real, tells them you have to do this for the children, you have to include the children. So anything, any questions, any problems you have, please ask, tell her to solve them, and I'm sure she's going to solve it. She has over 32 national and international paper presentations and 16 publications to her credit. She has a national award from the President of India itself, the Helen Keller Award, among other various awards. And she's also the lead author of the Guidelines for Comprehensive Management of Persons with Low Vision in India, a Vision 2020 Right to Sight India publication. She's so passionate about it because she herself has gone through this with her low vision and with a low vision impairment, and I'm sure she can guide us how to handle such children and patients. So why is cerebral visual impairment becoming important? We all know that it is a deficiency in the function of vision. Something is wrong with the visual pathways or processing centers in the brain, specifically those posterior to lateral geniculate body. Eyes work fine, but the brain does not understand or interpret what the eyes see. So this is so important, because parents always come to us say that the child can't see, and we have to explain to them why the child can't see. It is becoming important in India because with the improved management and survival of children affected by brain injury due to perinatal insult, metabolic diseases of trauma, it is becoming the increasing cause of visual impairment in our population. The multiple disabilities also make assessment and management of such children a specialized and challenging field. In Shroff itself in Delhi, in the last from 2014 to 2020, we've seen around more than 500 children, and this is why I've developed this passion and said that okay, if we can treat all these children under one roof, it would be a real boon. But it's not possible. But we should all aim towards making this dream possible. It will emerge as one of the main cause of visual impairment, maybe after myopia. So we should we should be interested in it. So vision is a neural association, the dorsal and ventral stream functions. I think this will be told in detail by Dr. Sovita Rath. So whenever there is subnormal vision, a detailed ophthalmic examination is required. There is an abnormal anterior visual pathway, it is not CVI. If it's an ocular disease, it's not CVI, but you find everything is normal and still there's a disproportionately subnormal vision, suspect CVI, and a neurological evaluation like an MRI imaging or history has to be taken in detail to find out if there was any perinatal or